Hello, everyone. Welcome to the Friday Transportation Seminar sponsored by TREC, the Transportation Research and Education Center at Portland State University. So my name is Jennifer Dill, and I'll be introducing today's seminar. And my colleague Chris Monsieur will be joining us a little late today. So our Friday Transportation Seminars have been a tradition since the year 2000. These seminars are usually held live on the Portland State University's urban campus that is located on the ancestral homelands of the Multnomah, Cathlamet, Clackamas, Tumwater, Watlala bands of the Chinook, the Tualatin, Kalapuya, and many other indigenous nations of the Columbia River. It is important to acknowledge that we are here because of the sacrifices forced on the indigenous ancestors of this place, remember these communities, and honor their legacy, lives, and descendants. Due to the COVID-19 pandemic, today's seminar will be hosted fully online. This fall's Friday transportation lineup, we've been focusing on equity in transportation, recent research, and practice. And today we're very pleased to have Charlene McGee from Multnomah County joining us to present on the intersection of safety, race, and transportation. Charlene brings over 15 years of leadership working at the intersection of public health and healthcare systems. As a Liberian Oregonian, her experiences as a survivor of the Liberian Civil War and as a Black immigrant influenced her career in health equity, policy, and program development. She holds a Bachelor of Science in Public Health, Health Promotion, and Education with a minor in Community Health, and recently earned an Executive Master's degree in Public Administration from Portland State University. Before jumping into her presentation, I want to alert you to a couple upcoming seminars. Next week, we will be joined by Nikatris Perkins from the Oregon DOT talking about curating equitable transportation. And for those of you who may be new to using GoToWebinar or a little rusty because you've been on Zoom for the past several months, I just want to remind you that if you want to ask questions, we are reserving time at the end for questions, and use the questions box in the window. Type your question in there at any time, and at the end we'll be sharing those with Charlene to answer. The webinar is being recorded. We'll be posting the recording and the slides online afterwards. We'll be sending you a link to that so you can watch it again or share it with your colleagues, and we encourage you. And of course, as usual, we've been approved for 1 hour of professional development credits. So with that, I am going to turn it over to Charlene McGee.
Thank you. So good morning and good almost afternoon. Jennifer, can you hear me okay?
Yes, and I see your slides, so.
You saying you can't see the slides?
No, I do, sorry.
Okay, great.
Your slides.
So good morning and happy Friday. As said, my name is Charlene McGee, and I have the privilege of working as Multnomah County's REACH Program Manager. And REACH stands for Racial and Ethnic Approaches to Community Health. And I will share and speak a little bit more about the REACH work. So as public health practitioners, we know that public health science and best practice emphasize prevention as a means to tackling our most pressing community health issues. Focusing on upstream interventions has long been a goal and practice of our public health division here at Multnomah County. In Multnomah County, prevention and equity are current budget priorities within our division and our organization. It enables us to work better towards redressing health challenges. So before I go into my presentation, I definitely want to acknowledge that the data that will be shared represent real people who are members of our community. These individuals are sisters, brothers, mother and fathers, and friends of our community. And also, I just also want to remind and acknowledge the current state of affairs that we have within our country. There's multiple ways of toxic stress being flow. I encourage you definitely to create the time to care for yourself, take some deep breaths. And, you know, I think really as part of our collective trauma that we're experiencing, there's also an opportunity to explore collective healing. And I'm hoping that through my presentation and the work that I'll share, that it will inspire you and encourage you to continue to begin in or continue that journey. So for a little context in terms of where we're going to go and how we'll spend our time today, I'll provide some context around how and why the REACH work came to be, speaking to transportation as a social determinant of health, and by doing so, really sharing some health equity tools to help to inform our work. And then conclude with, you know, what I'm referencing as action items to bridge racial health and transportation equity. So definitely reflecting on, you know, when we think about the world of transportation, it really is and remains a true civil rights issue. Dr. King led the Montgomery bus boycott. There are numerous events that occurred during the course of the civil rights movement that were really associated with transportation. And I think now, as we see ourselves with the multiple waves of pandemic that are occurring, we definitely have to clinch onto the fierce urgency of now. So really just sharing this quote, recognizing the moment that we sit in and the opportunity that we have to continue the work. And that we really have no time to really sit out this work, as hard and difficult as it may be. So for Multnomah County, just like quick context, we have about, so within Multnomah County, the Black population represent about 7.8% of the county's population. We know that while our numbers may be relatively low, we know that within our community, there's ample strength and resiliency that exists. Yes, the REACH grant is a disparities-focused grant, but we also know that in spite of the disparities, we know that our community brings a lot of wealth, a lot of cultural resilience, and a lot of, you know, a lot of courage and a lot of hope to really rise above challenges that we have and continue to encounter. While the grant definitely is, you know, again, focused on disparities, we know that being Black is not a risk factor, but rather that the conditions in which our community live contributes to the disparities that we're talking about. So this is just some data to inform. So within Multnomah County, we know that African American family income is less than that of our white counterparts. We know that the poverty rate among African American children is nearly 50% compared to 13% for white children. And almost full-time and Black children are almost full-time as likely to have our children living in poverty compared to non-Latino whites. And then also another data that's also important to share is that 2 in 5 adults report emotional distress from treatment based on race. And as I talk through our presentation today, we'll definitely hear about some of the over-policing and racial bias that we see that shows up in transportation-related data and how that impacts health. So again, this is another data because the REACH grant is a chronic disease grant. We know that toxic stress, including racism, you know, lack of access to safe infrastructure really contributes to the chronic disease disparities that we're seeing and experiencing both nationally and locally. This slide speaks to the disparities as it relates to diabetes, obesity, and high blood pressure. So the cost of really health inequities in Multnomah County is very costly, as you can see. We see that the estimated economic burden of health inequities is $442 million. And the number has also been broken out to really call out, you know, premature mortality, as well as indirect cost of illness. The next slide shows the impact of, so one of the things within public health that we talk about a lot and talk about often, it's really looking at the socio-ecological model. The socio-ecological model helps us to better understand public health issues and the effects of potential prevention strategies. This model considers the complex interplay between individual, relationship, community, and societal factors, because we know that with all of these, they contribute to the disparities that we see that we talk about. The overlapping rings in the model illustrates how factors at one level influences factors at another level. Besides helping to clarify these factors, the model also suggests that in order to prevent public health issues, it is necessary to act across multiple levels of the model all at the same time. This approach is more likely to sustain prevention efforts over time than any single intervention. And it's also important to know that with this model also, it's important to look beyond events and program and also look to identify policy systems and environmental changes to help to sustain the interventions that are brought forth. So a little bit about the REACH grants. So as I said earlier, REACH stands for Racial and Ethnic Approaches to Community Health. We are one of 31 grantees funded by the Center for Disease Control and Prevention that focuses on chronic disease prevention among communities and individuals most impacted. REACH is a national program, and here locally in Multnomah County, because of our stark disparities, our priority population for the grant are Multnomah County's Black and African immigrant and refugee populations. Within the REACH work, we work to address social determinants of health with a focus on communications campaign, as well as policy systems and environmental change. We utilize a combination of communication, policy systems, and environmental change at the population level to reduce the occurrence of the county's leading causes of death and to prevent morbidity and mortality within the population. We know that improving population health and addressing the health and social inequities that are among our leading causes of death and disability, that we will improve the overall health of our community. We lead explicitly, though not exclusively, with race, because racial inequities persist in every system across the country, without exception. So the REACH grants, we have 3 different strategic areas: nutrition, community clinical linkage, and the physical activity and built environment, which I will spend more time talking to today. Within the nutrition strategy, we are working to increase the breastfeeding rate, noting that breast milk is the first food, and we know the health benefits of that. Within that strategy, we have worked with the Sun Schools, we have culturally specific CSA, as well as working to develop healthy nutrition standards within various settings within our community, and helping to support and implement healthy food procurement processes within the county. With our community clinical linkage bucket, we work with community health workers as well as other healthcare providers to increase access to healthcare and safety net resources. With that work, we're also setting up a culturally specific tobacco cessation program. Really noting that with that work, over 10 years ago, our Achieve Coalition body identified menthol and tobacco flavor ban as a policy priority, and we'll remain focused on addressing that issue. So within the built environment work, we really look to improve pedestrian, bicycle, and transportation systems. We work with Safe Routes to School, as well as transportation partners, to improve and ensure safety, that our community members can transport, can move back and forth to everyday destinations safely. Within that bucket of work, we also work to reduce traffic fatalities and injuries within our project area. And additionally, within this work, we are also part of a national initiative being launched by the Center for Disease Control and Prevention called Active People, Healthy Nation, where we're looking at increasing the number of people who are engaging in physical activity. And we recognize, as part of increasing that, as part of being part of that campaign, it's also important to ensure that safety and equity are a part of it. We unfortunately have seen nationally and locally Black bodies out jogging or engaging in physical activity and being over police, harassed, and oftentimes leading to death or arrest. The two other cross-cutting themes within the REACH grant are economic development and social cohesion. Really, for us, economic development is also an important strategy because we note that, with the disparities and inequities that we're discussing and talking about, that economic development also remains a viable option with that, right? Just as easily as individuals are receiving prescription for medication for the high blood pressure, we believe that providing economic development opportunities can be an intervention. So getting more into the REACH physical activity body of work, we know that when we look at Multnomah County's 10 leading causes of death, we see that the 10 leading causes of death includes 8 various chronic disease. These 4 have direct link to various chronic disease. These 4 have really direct link to the physical activity in the built environment in which our community are walking and accessing. So these are quotes that I pulled from the PBOT's Walking While Black report. And I think really this speaks to, being Black and being in spaces in Portland. We know that safety matters when our community are trying to access the various modes of transportation and or to navigate urban planning efforts within the city. And an individual's safety really impacts their ability to access resources and or to engage in physical activity. We definitely also know that, within the transportation and urban sectors of the county and the city, we've seen a number of we've seen various incidents, starting with Vanport on how Black people have been displaced and gentrified. We've seen, Black and our African immigrant community members who have been killed. We know that when we also look at data, we're seeing, the overrepresentation of death, both in walking, biking, and enforcement within our county data. Again, this is another slide that just shows the county 10 leading causes of death. And the 3, looking at the air pollution, right, really recognizing the impact of climate change also within our work. We see also the impact of, traffic injuries being called out under the unintentional injury category. And we see the connection between physical inactivity to a number of the chronic disease noted within our 10 leading causes of death. So this slide really shows the traffic crashes. We recognize that traffic crashes are contributor to unintentional injury. It accounts for the 3rd leading causes of death in Multnomah County during a 10-year period. The mortality rate from unintentional injuries for Multnomah County's Black residents is 1.7 times the rate of white residents within the county. We must emphasize safety beyond physical injury, incorporating, while incorporating the definition of, transportation safety that envisions public space where people are free from physical harm, biased behavior, harassment, violence, and unfair policing. For the health outcomes influenced by transportation, disparities exist by race. Disparities exist by race, ethnicity, and socioeconomic status within Multnomah County. Disproportionate exposure to injury, air pollution, and noise contributes to inequitable burdens of injuries and chronic disease among race and our various racial and ethnic groups. We know that the exposure rate and burden, definitely have both short and long-term impact on communities' health. Definitely not lost within the transportation, context is also recognizing the historical context of racial planning. Structural racism has been shown to have a broad impact on the health of Black Americans, driving disparities at the population level, creating disproportionately burden both for maternity and mortality rates in nearly every health category. We know while segregation and other discriminatory practice have been illegal in the U.S., we know that the long-term effects of this and informal discrimination and redlinings of our communities continue to have impact and toll on our health. Rail lining still occurs, but now there are new methods that have been created to create inequities both around housing and health, which we know also have impacts on the community's health. So looking at this visual is an example comparing two locations here in Portland, within the county. We're seeing, the green line represents sidewalk, while the red represents missing sidewalks on both sides. Both maps are at the same scale. Both, what does it mean to be displaced from the neighborhood on the left to the neighborhood on the right, where you go from having more sidewalks and being pushed and forced into neighborhoods where you have less sidewalks. We know that in terms of active transportation, it means that fewer sidewalks and fewer routes means less access. We know that fewer routes means that pedestrians are funneled into streets with fast-moving traffic. There's no quiet side street through those routes. We also know that it means that many streets are lacking protective infrastructure like sidewalks. It means that it's much harder for individuals to engage in physical activity as part of daily life. And I think also it's important to know, we know that the impact of gentrification, it impacts health, right? It impacts more than an individual simply moving from one place. It disconnects individuals to the community and impacts their social connection. And as we look at, as we talk about gentrification, right, I think it's also thinking about what does it look like for development to occur without displacement, right? And recognizing that displacement impacts health. So while this is a great image, I found myself wondering and reflecting on this. I imagine myself as a Somali mother of 2 children under the age of 5. Having no idea how to ride a bike, I don't see myself represented in this image. And I think rather is thinking about justice as we look to do and execute our various work, right? What does it look like if the various modes of transportation will, the various modes of transportation were recognized within our various work? How do we ensure that as we're developing modes and encouraging, more individuals to get on bike, that we're also recognizing and stopping to pause and wonder about those who are not at the table to give perspectives, right? So thinking about those individuals who live, who sleep or reside in what's called the numbers, so out in East County, but are commuting and coming out to inner North and Northeast Portland for school. Biking is not always or necessarily easier or the best route for them. So definitely considering how justice factors into the work. So the next series of slides, I will provide some tools that we have found useful in our collective effort to advance health equity. This slide and the next slide after are what we refer to as the 5 Ps tool, where we know that, when they're used to improve planning and decision making and around allocation of resources, it helps to ensure that the people, place, process, and power are all considered. We know that, there are times when, yes, we're looking to engage community, but if an individual is not at the table, sometimes their voice is missing. So sometimes it's best for us to stop and pause and ask, who's missing? What are the unintentional consequences of the action and or decision that's been made in this moment? So again, within the 5 Ps, there are a series of different questions that help to guide and help to inform the process. Within the people section, right, one of the questions, considering it, how might communities of color be traumatized and or re-traumatized by this issue or decision? Within the place, another question, how are public resources and investment distributed geographically, right? So ensuring that if you live in the north, south, or eastern part of the county, that you feel like the resources and investments in development are benefiting your communities as well. Within the process, how are we meaningfully including or excluding people, including communities of color who are affected by this decision that's been made? And then another question to explore within the power, right? What are the benefits to doing equity and racial justice work? So one of the things that we're very intentional about within the REACH program and at the county is really ensuring that community engagement is key and pivotal to everything we do. Yes, we know that with that engagement that sometimes it slows the work, but we know that there's value when you're giving people who are experiencing the challenges that you're looking to address opportunities to engage and inform that decision that will affect them. Really stopping and slowing the process to have individuals to inform, consult, be involved, to collaborate, and really ultimately empowering them to ensure that their voices and their solutions are part of the conversation what will be had. And I also think one of the things that's important with community engagement, it's really being upfront and being authentic in engagement and letting the community know what's really possible, what's not possible. Because we've heard from community members as folks have tried to engage, they feel like they've engaged, and then in the end, they still didn't end up with the outcome that they had hoped for. So within the REACH program, as I shared earlier, we're really intentional about leveraging the power of communications campaign that really connects the behavioral health education and strategy. We know that with communications, it helps to change and shift the conversations and narrative. Really, what is sustaining around health equity is ensuring that there are policy systems and environmental changes that are being identified, developed, and implemented to correct historical injustices, to reinforce accountability, and also ensure that you're altering the physical space to ensure safety and equity within the progress that's been made. So this is some example of the current REACH work. I spoke a little bit about the Active People Healthy Nation. We started a soft launch here in the fall, but looking to definitely do a full launch in the spring in spite of the current state of affairs with COVID, but really looking at how we partnering to bring and ensure that safety is part of our message to encourage physical activity for everyone within our community. We've also have launched this past year, the REACH Black Transportation Academy, and really that process is another community engagement tool that we use to recruit and invite community members and others who are decision makers within the planning, engineering, transportation field. With that work, we're hoping that through exposing and educating the community on how they can see themselves show up, that will result in more community members engaging and serving on various boards and committees. This is the orange image that you see is a screenshot of an executive summary of a soon-to-be released traffic safety report. That traffic safety report is a baseline data that really speaks to the disparities that we know that exist within Multnomah County's Black and African immigrant population. And more with that once it's released fully. One of the other things I also wanted to share, because we often tend to hear from folks that why focus on race? By focusing on the Black community means that you're excluding. And I think it's important to note that while the REACH grant is focused on Multnomah County's Black and African immigrant communities, we also know that a number of our work and a number of our success story ties into benefiting everyone. And one of the projects that we've been a part of is the Rockwool Bike Path. And just to speak a little bit to our partnership with the City of Gresham. So the REACH program actually funded the City of Gresham's first active transportation plan. Within that plan, a number of different routes and projects were identified to improve the safety of all. This is the Rockwool Bike Path is one project that was recently completed, where it has improved and enhanced the safety of the community. The picture in the middle with some of our partnership with our Safe Routes to School partners out in East County. So here are some tips, over the course of our work. Both we've worked in partnership with PBOD, the City of Gresham, that we really have found useful in terms of really centering the Black experience in active transportation. We know that it's important to really build capacity. We know that it's important to slow and listen. We know that with the, with building power, sometimes and oftentimes they require us to release our power as government when we're coming to the table with the community. It's recognizing that the community know what they want and that the community really have within them the solution. Oftentimes what they need are the resources and the technical assistance to give them what they need. I think it is also important to note the importance of diversifying the pipeline in our transportation industry, because we know that with diversity, it helps to ensure that all our community members are reflected and represented. We know the history of community matters when we're going in there, and we know that sometimes because of that history, we have to slow down, we have to change and make shifts to adjust how we're delivering programs, how we're making decisions. I think another thing that's also important to note is that it's also important to acknowledge who is missing versus who is showing up. We've seen that sometimes, if an individual is not showing up, sometimes they're not there not because they don't want to be, but rather they have competing priorities that are impacting their ability to, give review on a transportation plan, or to show up to share their concerns about what may or may not be happening in the community. So really thinking about, what are some of the strategies to really look at authentic engagement beyond that. And I think definitely, regardless of where we all sit as students, as public health practitioners, urban planners, we definitely have opportunities to lead. And these are some ideas and recommendations that we're proposing with our work. Definitely thinking about transportation justice. How are we ensuring safety and equity, leveraging and applying the equity lens. For planners and others who are making decisions around development within the city, county, state, and region, how do we do development without displacement? How do we ensure that residents who have been born in an area can benefit from the development, the economic development or the economic mobility efforts that are happening within there? We know that community engagement is a participatory action approach that, when combined, we can really help to continue to make progress toward health equity and justice. Another piece that's also important within our work, and another critical recommendation, is ensuring that we're collecting and desegregating data. Oftentimes, data are hard for, various communities of color, including like our Pacific Islanders community members. How are we collecting data to really ensure that we are really aware of the impact of actions on our various communities that we're serving? We know that, with COVID and so much that has happened over the course of the last 8 months, we really know it's important to be flexible and be innovative in terms of how we intend to reach and engage the community. For us, one of the ideas that I also shared was looking at the Black Transportation Academy. We also have walk audits as part of our opportunity to get community members engaged in physical activity. Photo Voice is something that we're also exploring as well. We know that authentic engagement is very important. It also takes time to really build that, right? So really pausing to build relationship is important. Yes, we recognize that, there are timelines and deliverables that need to happen, but ensuring that you're really building that authentic relationship so that the community feels heard, seen, and appreciated. We know that representation on boards, committees, and commission matters, but I think it's also ensuring that the boards, committee, and commissions are also prepared for diverse perspective, right? What does support look like? Who's been mentored? What does onboarding process look like? As you're bringing our community members on to serve on these various boards, providing the necessary support, which oftentimes should include compensation for their time and expertise, because just as we show up as professionals and are paid for sharing our expertise, it's also important to recognize the expertise of our community. We realize too within our work that it's also important to formalize and document commitments to ensure accountability. Communities show up and oftentimes they don't hear back, or they don't know where to go to find that follow-up information, right? So how are you documenting and formalizing and really ensuring accountability with engagement? Another really important recommendation, as we know, we've heard and seen a number of times from both the soon-to-be reached Transportation Safety Report, and we've also heard from the PBOT's Walking While Black report. What does it look like if we could center a transportation safety campaign that centers the Black experience in Black men, right? Recognizing that Black men are standing at the crosswalk 30% times longer than their white counterparts. And I think lastly, it will be remiss not to, recommend really the importance of us really working across our various profession. Health in all policy is an approach that we definitely appreciate, I think, both as public health, as the health department, but recognizing that within every sector, every decision that is made has a health impact. So it's important for us to really look at, building those bridges and connecting the dots with each other. These are just various tools. Once the slide is shared, the hyperlink that we found to be useful to help to inform our work, and I believe that you will find those to be useful as well. And that concludes my presentation. So I think we can go into question and answer.
Great. Thank you very much. I really enjoyed hearing about the program, and I'll just quickly welcome Chris Monsieur joining us midstream. So I encourage all of you who have been watching and listening to go ahead and type some questions in. But we do have one that was actually consistent with the question I had, is several of us would like to hear more about the Black Transportation Academy. And specifically, one of the questions, or two of the questions are, what have some of the topics that have been discussed, and what are community members asked or invited to do as part of the program?
So the Reach Black Transportation Academy is a model and a concept that was set up to really expose and introduce the community to transportation. We heard during the start of the grant that oftentimes when the community hear transportation or urban planning, right, they feel like I'm showing up to a table just full of white people, just being transparent, right? Or people who don't necessarily look like me or reflect the community. So the Transportation Academy was really creating a space that invites Black community members to understand the historical perspective that have gone into planning efforts, to understand the historical perspective of where they find themselves. And I think it's also recognizing that we know within public health that where an individual plays, worships, shop, and works impacts their health. We know that individual zip code affects their health, right? So help to educate the community member around that. In terms of other stuff that's focused, we also share different committee opportunities with folks who have attended. As we get announcements about various committees opening, we share and disseminate that information. I think in terms of what folks will like to hear, we hear a lot of times community feel like you literally wake up and the next morning you're seeing, a part of the sidewalk being taken away to construct a bike, to create bike lanes. And I think part of it actually is also part of the Reach grant. It's like the why, right? We know the health benefits of biking, but I think oftentimes community don't necessarily see that connection, right? I think a lot of times folks also have negative experience, with gentrification and displacement and how community have been impacted and shifted. You hear the community talking about, when you see a Starbucks, a coffee shop, or if you see the Max being brought into your neighborhood, the next thing you know that you're going to be displaced from it, right? So how do we ensure, again, that the community understands the decisions that have been made, and then what are the measures that are being put in place to ensure that folks are not being pushed further and further out or being displaced from the communities that they were born into or been connected to.
Thank you.
Yeah, apologize for joining late. I had a back-to-back meeting. So I missed a little bit of the beginning of your presentation, but so hopefully I can put the questions in context. But I think this question is about specific outreach strategies. So what are your thoughts in terms of what strategies are most successful in terms of connecting mailers, social media, open houses, online open houses, to get, like as you said, the people that want to provide input, but just aren't necessarily have the time to be involved.
So I think part of it really is going where the community exists. So as part of the Reach grant, we have a community advisory board called the Achieve Coalition. So the Achieve Coalition includes our multi-sectoral partners. It includes Black-led and Black-serving organizations. It includes faith leaders, businesses, educators, right? So I think sometimes we want the community to come to us. I think it's important to go to the tables and locations where, the community is all, also convening. I think, yes, actually to the Reach Grant, one of the things we have been doing a ton lately, are giving inputs to various, plans and giving some technical reviews. Through our various medium, we also help to share and disseminate the information. But I think we also recognize, right, as professionals, as I'm sitting there reading, a 20 or 30-page document, that oftentimes our community may not have that time to do it, right? So how are we helping to make the information digestible so that folks aren't overwhelmed as they're trying to give feedback? I think really thinking about, again, places where you can go where community are already engaging. There are a number of different Facebook groups. There are different community leaders who have connections, who can really engage, folks through the social media, especially like Facebook or Instagram, right? I think partnering, connecting with those community influencers are another opportunity to think about and explore. I think there is it, and I think one of the other things we also seem to is sometimes the timeline literally feels so rushed that oftentimes when it's been brought to the attention, of community, people are like, I'm already overwhelmed with so much that's going on. I think we probably all feel that pressure now more than ever. I definitely think really going to where the community is already meeting and convening. I know it's slightly harder now with COVID, but like sponsoring and going to different community events. I remember we started with Reach. We actually supported the first Juneteenth celebration out in East County at Vince Park, and that event we pulled it off in like 6 weeks. It was amazing. It was phenomenal. But I think that's another example that shows where when the community wants something, we showed up. What do you need us to do to help to make it happen? We did outreach in that neighborhood, and so many of the community members who came shared that they literally live right across the street from Vince Park, but had never been to the park, right? And I think sometimes we tend to think, oh, because the park is there, the community know that they can come, right? So how are we normalizing, resources and services that are in existence to encourage and ensure that community one feels safe and feel welcome as people are engaging, both the space and attending the meetings to give feedback.
Great. So we have a question here about some of the analysis that might be informing the work on your program. And so there are, from the transportation planning world, we often use tools of GIS, and we pair that with census data and sort of analyze people's access to grocery stores or healthcare, and can do those analyses by race and other demographic groups. And so as part of this program, have you partnered with any agencies or done any of that type of analysis internally? Or?
Absolutely. So as part of the Reach Grant, we also have colleagues within environmental health. We work with folks in county transportation who definitely have the GIS capacity and knowledge and expertise. That is definitely not mine. We also have a great relationship and partnership with City of Gresham, as well as Portland Bureau of Transportation. So yeah, we do have access to GIS data that overlays, that can overlay to show the disparities, both for, access to grocery stores, and then I forgot what other one you said. You said access to grocery stores, like parks. Density also is something that we also look at. So yes, we do have access to those data. Some are also the data when we speak about too around the injuries and fatalities. That data too have been obtained from various database that the county have access to. Some of that includes ER data and data that the county has access to. Did that answer the question?
Yes, I think it did.
Okay, question. Has Reach previously partnered on multi-mobility efforts like Sunday Parkways in Portland or the annual walk and roll to school events?
So we've actually been engaged with, we started to engage more, and then COVID happened. And actually in the time now with COVID, we have partnered with Sunday Parkways we did a couple of different videos that were posted and created. We actually have a meeting coming up sometime this month where we're looking at enhancing and growing that partnership and really thinking about how do we leverage, how do we build upon the work of Sunday Parkways, right? What are those opportunities to bring in additional public health intervention, which I know require us to be creative in the midst of COVID, but we're definitely exploring that. And actually last year also, we partnered with the folks at the city of Portland, including the staff, the team that conducts Sunday Parkway, where we supported a Black community-led walk out in Northeast Portland. Because one of the things that we also hear from our community members are like, yes, we know Sunday Parkways is happening, but we don't think Sunday Parkway is for us. Right? So part of the conversation is continuing to work to ensure that the community feels represented, that we're engaging, and that the community sees that Sunday Parkway is a space to bring them in. So like as an example, on that day when we did the, it was called the Next Level Walk, like over 300 community members came up for that event. None of them have been to Sunday Parkways, right? So I think it shows that yes, we can have a huge event like Sunday Parkways, but sometimes individuals in our community may not see themselves represented of being a part of it.
Great, thank you. So a little related to that, we have a question. Can you speak a little more about striking the balance between communicating the limits of what is possible with a project or program such as yours, while not inadvertently shutting down some great ideas that might be dreaming a little bigger or that are out of the box?
So, you know, as government, we face that all the time and every day. I mean, I think definitely we have limitations, right? Because our funding, we're funded both through the CDC as well as county general funds. With our dollars from the feds, there are various limitations around what we can and can do. Oftentimes, so REACH actually through our work, one of the things that's also important for REACH on our economic piece is that we really look to have contractual partnerships with different community groups and individuals who we know can reach the community and help us to meet our grant deliverables. We know a lot of times, yes, the funding that we give may not be substantial, but we know that, and we encourage our partners to use the funds and what we can do to look for other opportunities to leverage their funds. You know, I think part of it also is the opportunity to really explore, you know, public-private partnerships, right? For the limitations that government may have, private foundations may not have it. You know, I'll give you one example of one of our partners that we are blown away with, right? Over the course of the last 2 years, we've been able to partner with them for a total of $25,000. They've been able to leverage that funds and have received almost $800,000 in grant funds, right? Definitely grant funds and things that the REACH funding cannot do, but now they've been able to leverage that relationship and that work to apply for funding. So I'll definitely say I think part of it is really being innovative and, you know, really slowing to say no, right? But helping to think through, right? What are the options? What are the opportunities? Because I think if we can think and really look at ways in which we're innovating, there are ample opportunities out there that exist. You know, actually, I'll say to that question too, right? So also like with the REACH grant, like one of the things that we cannot do, we cannot pay for infrastructures, right? But we've written a number of successful letters of support for our partners at City of Gresham, where they've been able to apply for funding, you know, from other regional and other partners to get funds for, you know, different infrastructure projects that they've been able to do.
Great. We're tag teaming the questions. I think Chris is up next.
I don't, that one I asked the question.
Okay, sorry, I'm losing track. So actually, since you just mentioned infrastructure, maybe talk about some of the discussions. There's a lot of discussions in active transportation about how to reallocate road space and support more active transportation and healthier modes of transportation. And maybe talk a little bit about how that fits into some of the programs that you've worked on, and maybe that the Gresham Bikeway example or so.
Yeah, I mean, I think around that piece about, I think definitely for our community, the part about active transportation. Oftentimes when people hear like, what does that mean? What are you talking about? Right. So I think for those of us who are in the field or who are used to the terminology, we know what it means, right? It's the walking, it's the biking, and it's engaging in, it's engaging those different modes. So I think one is helping the community to understand what it means and how it benefits them. I think a lot of times really when we see our community talking about what they're experiencing now, they're really tying in and connecting it to things that have happened in the past, right? I really think part of the work for transportation urban planning is really acknowledging the harm that have been done and acknowledging ways in which they can be corrected. And I think also being intentional about what are you doing in the now to prevent what happened in the past. I think it's really about educating the community to understand. I think is listening. I think, just even connecting to one of the earlier questions, right? We know there are times when you have such a strict deadline that you literally have to keep moving, right? And I think sometimes it's about telling the community, I may not be able to slow down on this project, but thinking about that next project that's coming up, right? On how are you slowing it down to gear and address the community's concern. I think around the piece around infrastructure again, I remember, actually, I even use a personal story. So my parents live in the Concordia neighborhood, and my mom also runs an in-home daycare, childcare program. And she called me, she's like, I don't know what they're doing. They came and now I see, they have this stuff here and they're talking about bike lanes. How did this even happen? Right. And I'm like, okay, like, first of all, that's not Multnomah County, right? That's within the city of Portland, right? So for her, she thought that was like the county thing. And I think sometimes, part of it is our community also don't even know the difference between, what the county is supposed to do versus what the city's doing or ODOT, right? I think it really is about educating and engaging the community to understand, like the infrastructure barriers that we're looking at, and I think also as we're looking at, various infrastructure opportunities of bringing in different ideas and concepts, it's also about ensuring that we're not recreating inequities. I know one of the things that we've talked about too, is around like the self-driving cars, right? We know that those cars aren't even recognizing dark-skinned people, right? So like implicit bias is showing up in the future technology that's being created, right? So how do we ensure that we're really acknowledging and addressing implicit bias? Because if it's not addressed, it is going to show up in future planning and other opportunities that are being developed.
Great. A question here. I've heard multiple times that community members don't think of an event, park, or bike lane as for them. Is the answer as simple as direct invitations to join, or is it a combination of inviting participation and more complex outreach?
I think it's more complex. I would say it's everything, right? I mean, I'll even just use myself as an example. So prior to even doing the reach work, there's a community group called African American Outdoors Association. And part of it, like, I wasn't even used to the outdoors, right? Yes, the more I've learned and researched, like the Black and African connection to the outdoors is there. And I think sometimes people have associated, right, biking or being outdoors or hiking or even farming and agriculture, right, those different things as being quote unquote white, right, or not for me. I think some of it is showing representation, is allowing people to see themselves in those images that are being out there and being portrayed. I think, and also some of it too, and I mean, like, I think just even since my own personal experience, like one of the things I've been also very intentional about with both myself and the Reach team is that we're engaging in these things that we're encouraging the community to do. So this year, one of the things I've been doing a lot of, actually, in post-grad school, I've been going on these long bike rides, right? I started riding bike more and more and more. I'm still trying to figure out how to ride bike in the fall. Year is possible, but I'm not there yet. I think, right, it's like, how do you help to continue that? But I'll also say, like, being aware of the data and disparities, as I find myself even riding bikes in different parts of the city, honestly, it's stressful. It's stressful. Like, my son loves riding bikes. Some of the path I take, like, I'm like, I wouldn't even have him ride this, right? Although there's a bike lane, honestly, I don't think just having a bike lane in the location also means that it's safe. I think some of it is really thinking about, you know, I mean, we know like implicit bias shows up on the roadway, right? Yes, we also know roadway shows up, but I think it's really one, helping community to see themselves within it. It's helping to make it possible, you know, and honestly, also riding bike is also expensive, right? Not all of our community have access to disposable income to be able to do so. You know, so I think definitely my response to that question that it's complex. There are definitely a number of different strategies to incorporate, but I think it's definitely not giving up. You know, and I think the other thing for us to note and acknowledge too is that change is also incremental. You know, there are also various community groups out here, including the African American Outdoors Association, you know, the Black Girls Ride Bikes. You know, how do you tap into those existing community networks again, right? To build upon those, to help to connect to the community and what we're trying to do. We actually had a number of different events planned, and then COVID showed up. You know, one of the things that we know people love to do are having like group bike rides. I spoke to it earlier, like when we partnered with the city of Gresham when we did Juneteenth, we had 50 bikes. Actually, that was another partnership with Peabody and the Sunday Parkway staff, where they helped us. We had like 50 bikes, brought them out into East County, and they're like, "Are you sure people are going to show up?" Like within the first 20 minutes, all the bikes are gone. They're like, "How did you do that?" I was like, you know, I think sometimes just knowing and talking to the community, right? And we set it up where we went and did like a historical bike tour out in East County. You know, so I think it's definitely it's complex outreach, but I think it's not giving it. I think it's thinking about tapping into existing community network and just being intentional about, you know, connecting with the community.
So I'm sitting here and both Chris and I, you know, we teach future transportation planners and engineers who are increasingly partnering with health agencies. And I am curious from your experience working on this project, if you had some advice to give our transportation professionals on how to collaborate on this type of work better. Is there anything in particular that you would advise?
So, I mean, I would say one opportunity I can think of, like, I don't think we have a formal partnership, right? I think it would be great to set a partnership with, like your local public health department. It would be great to have, you know, future engineers and planners to really, I think, honestly, dig in, right? Dig in personally and do that work around racial equity, right? Implicit bias, because we know that that shows up intentionally or unintentionally in the work that you're also doing. I think again, it's looking at, you know, health in a very broad perspective and really thinking about the health implications, right? What are those unintended consequences of what it is you might be thinking about doing? Honestly, I think there are ample opportunities to partner with the county. I think there are ample opportunities for us to really, you know, break down the silos, because at the end of the day, all of this connect, right? At the end of the day, we're all talking about the same people in the same community. But I think sometimes we're so focused in our respective lanes that we tend to forget, you know, that we are here really doing the same work together. You know, I'll say, I think it'll be great to even have information around like the 10 leading causes of death within the county, right? And how that can, you know, a more in-depth one, you know, really looks at how the health issues and health disparity that shows up, right? The connection to transportation. You know, I'll definitely say part of that is also looking at, you know, what are some of those environmental changes that need to happen. Like I know, like as I started to do this work, just reading more, you know, seeing that like lighting matters, right? There's certain kind of lights, if it bounces off my darker skin tones, I may or may not be visible in the dark, right? So what are the technology, what's showing up, and how do we ensure that when we're building and what we're creating, we're really creating for all of our community members, right? Both community members, I think, but community members also, you know, in wheelchairs, right? Folks who we literally all are literally trying to move, right? And if we can really build equitable and accessible, you know, spaces and places, that we're really building it for all, right? So if a wheelchair can safely move, it also helps that family who may have their child in a stroller. So I think really just thinking about how we can connect the dots, and really, I think recognizing that really equity and race-based work benefits us all, right? having a culturally specific program doesn't mean that we're excluding everybody, that it really benefits all. And I think sometimes folks, you know, some folks tend to feel that it's excluding. So I'll say dig into the work and, you know, partner, collaborate. I'm happy to always make connections to folks in the health department if the REACH program is not, you know, good fit as well.
Great. We are at our time. I'm going to switch, I think. I was trying to switch it to my screen, but maybe Teresa will do that. There we go. And normally we'd be in a room. We're going to test out some virtual applause for you. I don't know. I can hear it. Can anyone else hear it? No? Okay.
No.
I guess we have to play it.
Thank you.
Play it over the mic, I guess.
Okay. Well, I tried. We didn't practice that one ahead of time, but we wish we could applaud you in person. And whoops, let's see. But I will also, in addition to thanking you, Charlene, for your presentation, it was really great to hear about the program that you're working on. I just want to remind everyone, if you aren't already, to sign up for our newsletter. And when you close out today's webinar, you will get a very quick survey to get us some feedback. And we will be sharing, there were maybe a couple questions that we didn't quite get to that we'll be sharing with Charlene afterwards. We'll be posting the slides and the video. And I will also warn Charlene, since we didn't beforehand, that the webinar will end for everyone. So this is our time to say goodbye.
Okay.
To you somewhat abruptly. Have to apologize for that.
No problem. Thank you for the opportunity. I look forward to connecting with you all, and I would love to come back once we do a full release of the transportation safety report.
Yeah, I had my eye on that. I'm looking forward to it.
We have to present it to the chair and the commission. You know, we got to go through our process.
Of course. So with that, I'm going to say goodbye to everyone, and thank you for joining us today.
Thank you. All right, bye-bye.